Tēnā koutou. Me karakia tātou. Tu taua mai I runga, tu taua mai I raro, tu taua mai I roto, tu taua mai I waho, kia tau ai, te mori tū, te mori ora, ki te katoa, homie, huie, taikie. Ko Jane toku ingoa, tēnā tātou katoa. As we begin this session about the snapshot clinical audits, I encourage you to take a minute and think about what do you bring coming into the snapshot audits. When you think about snapshot clinical audits, what comes to mind? So in this first of 5 sessions, this is really just an introduction section. We've planned 5 sessions that you can feel free to pop in and out. We've targeted them for new coordinators, but everybody's welcome. We will make a copy of the slides available, as well as I'll try to record the sessions as well. So in this first session, we are going to share about the timeline for the snapshot audits, the context, why the data is collected, a little bit of what the data looks like using the data reports, and some relevant links. So the snapshot audit timeline, it's important to recognize that the period of eligibility to be included in the snapshot is the 3-month period, April through June. So that means that you can't begin to collate and record a random sample of records until at least the 1st of July. So we then have allowed 2 months for data collection in July and September. We are able to move that out a bit as needed if circumstances should arise. I think it's important to recognize the relevant links that we have available for the snapshot audit. So I'm going to click on this and just show you this is what our VIP evaluation website looks like. And if you move down to resources and downloads, here is a 2024 evaluation snapshot document. So feel free to go to that, have a look, and that will guide you through all the processes of the snapshot alongside these sessions that we're offering. The snapshot audit is only one component of the VIP systems approach to family violence responsiveness in the health system. So monitoring and evaluation sits alongside the other elements such as coordinators, guidelines, training resources, and technical support. Within monitoring and evaluation, 3 activities are supported. Monitoring system infrastructure through the Delphi audit, the clinical snapshot audits, and the Model for Improvement Plan, Do, Study, Act framework. From a program evaluation perspective, the clinical snapshot audits provide information about program outputs, the what. It is a means to collect standardized data to monitor VIP service delivery nationally. Collecting information about referrals provides an aspect working towards outcomes and providing women, children, and whānau access to specialist services. So the objective of the snapshot audits are to evaluate implementation of VIP for IPV and CAN and designated acute and community services. The reasons for this are for accountability, to measure change over time, to benchmark against one another, and to inform improvements. We have 2 expectations. First, we will talk with women who enter our service about family violence because family violence is a determinant of health, and we are in a position to offer a service that can improve health, well-being, and safety. Routine inquiry is routine rather than haphazard or ad hoc, just due to chance. And assessment rates will be equal for Māori and non-Māori women. Our second expectation is that we will provide a quality assessment that is non-judgmental, caring, relational, culturally aware, to create a safe space for women who are impacted by family violence to disclose the abuse they are experiencing. And that has to do with the close relationship between the quality of the routine inquiry and the disclosures. In measuring service delivery, we recognize that measures must be meaningful to external parties, in this case, Te Whatu Ora and the public. They must be precise, reliable, and valid to be useful. They must be standardized, making sure to measure the same thing and to allow comparison. And it's important to realize that while Snapshot focuses on clinical service delivery measures, that we acknowledge they're only part of the picture. They do not tell us everything that we need to know. For example, there's much to be learned from listening to the experience of those involved in the program, from leaders to those who seek help in our services. Community input is critical to ensure that needs are being met. The Snapshot system focuses on 6 clinical service delivery areas: maternity, emergency department, and child health, and community services of alcohol and drug, mental health, and sexual health. And we know from this that there are some gaps in our system. So from Te Arere Kura and others, you will most likely know that we also need to focus on primary healthcare responsiveness as well. So what does the data look like? I thought it would be helpful, just as you're beginning to learn about Snapshot system, that you recognize what are we going to get out of it? What is the data going to look like? So the next couple slides provide a glimpse of what the data looks like. This slide has 2 screenshots from the Snapshot platform that you will all have access to in time. This is an example of showing the Community Mental Health Services IPV inquiry and disclosures for one district from 2019. So you can see that this is an official audit, a sample of 25, and this is a graph of the routine inquiry rates over time, which increased, and the disclosure rates over time. This is an example of the data available that we provide in updates to Te Whatu Ora and publish in our national reports. This data shows the distribution of inquiry and disclosure rates across the districts in 29 for alcohol and drugs. So you can see that the majority of the districts did quite well in routine inquiry, with only several falling over in this last service not implementing the VIP. Disclosure rates are also quite significant and not unexpected, given the relationship between alcohol and drug use for those who have experienced family violence. This slide actually graphs each of the locations that provided alcohol and drug services. And on the horizontal axis is the inquiry rate, and on the vertical axis is the disclosure rate. So each one of these dots represents a unique district service for alcohol and drugs. So for example, this green dot here has a routine inquiry rate of 60 and a disclosure rate of 80. Whereas this dot here has a routine inquiry rate that is nearing 90, and yet their disclosure rate is less than 5. So this just points out the relationship between inquiry and disclosure. And we believe, again, that the quality of the inquiry will influence the disclosure. So in many of the services, the disclosure rates are the expected above 25%, whereas some services are not meeting that goal. The data also allows us to look at data over time. So again, in alcohol and drugs, we can see that the inquiry rate over time is quite stable, and these bars are the 95% confidence intervals. And the disclosure rate has been somewhat stable with a little decrease in 2019. And the referral rate after the first year increased and has been fairly steady since then. This is just a summary of the different services. So you can see alcohol and drug again has quite good, generally, routine inquiry rates and high disclosure rates. So this vertical axis here is just 0 to 30. The emergency department, the bubble is the largest because that serves the largest population of people. So the number of women going through an emergency department nationwide is much larger than the number of women who are able to access alcohol and drug services. This is the expected disclosure rate, again, given the relationship between exposure and intimate partner violence and those mental health, alcohol and drug, and sexual health outcomes. This graph shows what we can do with the data and making inquiries about the system. So we can learn about the system from the data that we have. And in this case, looking at the Delphi infrastructure data alongside the routine inquiry data. So if we just look at the routine inquiry average across all the services across the snapshot audit against the Delphi score, you can see that they correlate quite highly. So as the Delphi score increases, so your system infrastructure is maturing, we can see that the service delivery actually also increases. So this is important for us, and it supports the importance of having strong infrastructure. As suggested by the model of improvement, the collection of data is only one part of the improvement picture. And I share this quote that I absolutely love. Weighing myself 10 times a day won't reduce my weight. No matter how sophisticated our measurements are, they're only indicators. What the indicators say are much less important than what's being done with the information. So measurements that don't lead to meaningful action aren't just useless, they are wasteful. So this just raises the issue for us that collecting the data is only one part of our model of improvement. Indeed, it's important for all of us in VIP services, at the district level, at the national program level, and indeed at the government level, that we all have a role to play in improving our performance and to be able to provide consistent and higher quality services to women and children experiencing abuse. So again, what we do with the information is important. We have to share it, we have to interpret it, and feed it into our quality improvement plan for priority setting, actions, responsibility, and timeline creation. So our snapshot audits, the data that you get from there is the data that you should enter in your reports to Te Whatu Ora. In the next section, next week, we'll talk about preparing for the snapshot audit. We'll talk about who should be involved, eligibility and sampling, what is it about a random sample, and how to log in. So I look forward to seeing you next week. And again, you can access more information on our VIP website. And I'll just close with a karakia. Kia whakaria te tapu, kia wātea te ara, kia turuki whakataha ai, kia turuki whakataha ai, o mie, huie, tai kie. Thank you, everybody.